didn't go like
Yeah, it's
still
online.
going.
Okay. Hello, doctor.
Hi.
Okay. So yesterday I got a very panicked call from my friend, and he said that he suddenly woke up with this drooling of his mouth and he could not close his eye. So, and then he's not able to move his face as much as he could before.
Right.
So, why do you think this could happen? So, I suspected Bell's palsy, but exactly what it is and why it's happened. Could you please explain it to me?
Yeah. See, what your cousin suffered is what you can call facial weakness,
Yeah.
right? The weakness of the facial muscles. Now, these muscles are controlled by nerve, right? And there is one nerve for each side. Nerve means they are wire-like structures which connect the brain and spinal cord to different parts of the body. And in this case, they are controlling the muscles and making them move, right? So whether you're smiling, talking, chewing food, or opening your eyes and doing things, the facial muscles are acting on both sides. But if one of the facial muscles is not working, then your mouth will tend to deviate to the other side, right? Or that side eye will not close. So this basically is what we call facial weakness. And the most common cause for facial weakness is Bell's palsy. Bell's palsy is, if I make an estimate, roughly it's about 99% of the times the causes of facial weaknesses, Bell's palsy. Of course, some people can have a stroke causing it, right, which is another common cause, but then only facial weakness because of stroke is a little less likely. And of course, there are a huge number of other conditions where this can happen, but all of them are a little rare. So the next question is, what is Bell's palsy? Why does it
Exactly.
happen,
Yeah.
right? So you've heard of autoimmune conditions, right?
Yes.
I think that's a buzzword now. A lot of people have heard of it. What it basically means is that the body's immune system, which is supposed to protect us from bacteria and virus, okay, it still plays a role, but sometimes it crosses the limit and it causes damage to our cells also, right? There are different mechanisms for it, but the basic point is that it's the body's own immune system affecting a certain part of the body. It's not a random thing, it's a very specific thing. So people may have some tendency, and then there is some trigger. That trigger could be a viral infection, and following the viral infection, the nerve is affected. What happens in Bell's palsy, that particular condition, is that the nerve undergoes some damage and then it undergoes some inflammation.
Right.
Inflammation is basically, as you know, as a medical student, you know that it is the body's reaction to any damage, right? So along with that, there is some swelling.
Yeah.
And the point is that the facial nerve passes through a kind of canal inside the ear where the space is little less. So it tends to, because the swelling, there is no space for it, so it undergoes compression also.
Right.
Now, because of it, this is the crucial point. What happens is the inflammation is reversible,
Okay.
but sometimes the compression leads to damage of the nerve, which may not be reversible. So there is a time window within which this should be brought down and quickly treated. Right? Basically, what has been observed is that if you give some medicines, anti-inflammatory, especially steroid, within the first 1 week, it has an effect and reduces the inflammation fast enough so that the effect of the decompression is not so much. Basically, that permanent damage doesn't happen, or at least it is minimized. This is basically Bell's palsy. So I think it is best that your cousin should immediately see a doctor. It's such a common condition, so practically any doctor can immediately identify and start some treatment. And of course, they would want to make sure that there is nothing else, so they would refer to a neurologist. But the treatment could be started.
Okay.
Yeah.
So another question I had was, do you think this is curable, or it can once you treat it, it can just go away and can it never come back or
Yeah.
anything like that?
I think basically you're asking two questions. Both of them are very important. First of all, this is very commonly people ask me, I hope I don't get it again,
Yeah.
right? Or can I get a cure for it, right? Now the point is, when you think of cure, what you're saying is that I take a course of treatment and then it never happens again, right? It is gone totally without a trace like that. That is, of course, not feasible. What happens is most people, they improve to such an extent that there is no residual functional problem. They are able to eat, drink, and talk and everything. Facial weakness is very distressing. It can be very troublesome if your eyes are watering all the time.
Yeah.
And the other day, one person was saying that, I have to interface with clients, customers, and it looks very bad if my mouth is deviating and all that. These are concerns, right? But the good thing is that they do improve. Okay, most people when they come back to me after say a few months or a year, they might remember I had facial weakness, but then I don't remember which side. I've seen this also. I might be able to make out because of slight deviation of mouth or something, but they themselves don't remember that. Which to me it indicates that it has improved sufficiently to that degree.
Right.
So I've seen that also. But having said that, there are occasionally some people who may not recover enough, right? The actual problem is about the eye being unable to close the eye, especially when they are sleeping. So there is the danger of exposure keratitis, damage to the cornea because it got exposed, which is the only really serious issue which can happen very, very rarely, but occasionally. So we have to be careful for that. That's one thing. Other than that, most people improve to some extent, and a majority improve enough to have a normal function.
Okay.
Right? In terms of recurrence, see, I have seen people who had recurrence, and if you see the literature, there are occasional reports like that, but it still is a rare condition. If somebody is having repeated attacks or more than one, you have to think of certain other diseases, and you have to really question whether it is Bell's palsy or something else.
Okay. All right.
Yeah.
Thank you, doctor.
Right. Thank you. It was really nice talking to you.
Thank you for answering questions.
Right.